Hi everyone, my name is Sukriti Shahi. I'm Assistant Beauty Editor at Femina, and we are here today with our panelists to increase consumer awareness on dermal fillers. But before we start with the discussion, I'd like to introduce everyone with our speakers for today. We have with us Mr. Sathya Narayan. Mr. Sathya has been with Galderma for 20 years. He's currently, he heads the company as the Managing Director, South Asia, leading prescription, consumer, aesthetics, and export business at Galderma India, and is successfully leading Galderma India's growth story by enabling digital transformation, e-commerce, commercial excellence, and innovation. Having 32 years of experience in the pharmaceutical industry, he's a member of the executive committee of OPPI, an organization representing the research-based pharmaceutical companies in India. Along with him, we have Dr. Monica Jacob. She is a consultant aesthetic physician with expertise in the field of aesthetic medicine for the past 2 decades. She is a pioneer for procedures like thread lift and dermal fillers, and recently started her own product line, which is a range of nutraceuticals for redefining skin, hair, weight loss, and anti-aging solutions. In fact, she also appeared on the Netflix show, The Fabulous Lives of Bollywood Wives, alongside our co-panelist, Neelam Kothari. And as I mentioned Neelam's name, Neelam, who charmed her fans as a leading lady of Bollywood in the 90s and 80s, with a number of hits with iconic numbers to her credit. Even years after being away from the silver screen, she continues to be celebrated for her impressive body of work spanning over 40 films. Along with her movie career, Neelam went on to carve a niche in the jewelry business. Her brand, Neelam Jewels, is known for bespoke pieces in fine gems and precious stones. Last year, Neelam made a comeback of sorts with Netflix reality show Fabulous Lives of Bollywood Wives. I love the show, by the way. Neelam, it was one of the most exciting shows I've watched. So yeah, it was so good to see you on the screen again. So I'll start with the discussion now, and I'll go to Mr. Sathya for my first question. And I want to ask you, Galderma, as we all know, has become synonymous to sensitive skincare with Cetaphil. But there's not much awareness in the dermal filler category per se. Could you please elaborate on Galderma's vision for aesthetics?
Yeah. First of all, nice to see you, Sukriti, again on the screen. And also, it's a privilege to share my screen with Neelam and also Dr. Monica. So as you all know, Galderma is the world's largest dermatology company. We are the world's largest independent dermatology company. We are into 3 verticals. We are into prescription, we are into consumer, we are into aesthetic. Yes. And globally, for us, aesthetic is the largest business. And whereas coming to India, aesthetic market is still small. And also again, we have a filler called Restylane. Restylane, we have the entire range of fillers available. Right. And also right from the launch in approval in 2003, we have been having a lot of newer SKUs in Restylane range. And also coming to India market, we want to get all the Restylane SKUs. And also again, we want to really do a lot of work in terms of customer education and also the medical education so that we are able to increase the market in India.
Right. So after that, I would now come to Dr. Monica, and I would want you to elaborate what you look for in a dermal filler when a patient approaches you for such treatment. I mean, what are the? Let's just put it this way. There's still a bit of apprehension around it. And do you also come across patients who come in with that kind of apprehension, and how do you deal with it?
So what happens is a lot of people are scared, injecting fillers in their face. They feel that they're going to be unnatural, or the results will be irreversible, and they're going to stay like this for the rest of their lives. Some people also have the apprehension that they're putting something on the face, they might get cancer tomorrow, and they shy away from doing these kind of procedures. So in this case, the awareness here is very important, and the right message should go that these are reversible procedures. They're not like earlier fillers that used to be there. Now, Restylane has a diverse range, I would say world's first diverse range of portfolio, where there is a special filler for every need. And they are combining two complementary gel technologies, which is Dasha and OBT, which is non-animal stabilized hyaluronic acid, and optimal balance technology. We're combining both together, and we have the entire range of filler with us. To, you know, it's a gel or a foam, whatever we need to do. So we have plastic, we have lift, you know, for a foaming filler. Then we have contouring. We have, you know, to replace volume, we have align, we have define for contouring, and for the lip we have kiss. So that the entire range of fillers make the entire result more predictable, precise, and reproducible. We can get, the best part is we can get a very natural looking result. Now, if I compare Restylane range with any other range, so whatever result is on label is the actual result. And it's completely reversible in case you want to reverse. So that's why I like this range of fillers.
All right. And that's according to you, how you would explain how this Restylane range is actually different from all the other derma fillers there in the market.
Yes.
Yeah. Mr. Sathya, would you want to give your thoughts on this question, that how Restylane is different from you know, other fillers in the market?
Yeah. So before I talk about the Restylane, I'd like to again talk about Dr. Monica was talking about. Still, the awareness is very, very less in India.
Yes.
That's because of the fear of injectables. So that's where again we need to do a lot of education in terms of consumer awareness. Also, how Restylane is different again. It's been in the market for more than 25 years, and then more than 50 million treatments have been done. Right? It's such a safe product, and we have the entire range. We have got two different technologies. One is OBT and also Nasha, and also we have got the different range of products for different needs. And if somebody wants to personalize the treatment, whether for lifting or for kiss or the nose, we have the different range of fillers available.
All right, all right. I'll come back to Dr. Monica once again. You did mention, you know, about these treatments and how they are different. But could you please explain the change in technology today that has made these skin treatments safer with the lasting results?
Yes, initially people used to undergo knife or do any surgical procedure or use the semi-permanent filler, which used to give complications, or they used to do pad fillers. But nowadays we are looking for something which is reversible. Because with aging, what's happening is the bone changes, the soft tissue changes, and whatever result we want today is not like a permanent thing. We keep changing, and that's why the needs keep changing. So we need something which is reversible, and we can keep doing it again and again and give a reproducible result. So that's why the new fillers are completely reversible. They have a longevity, and you know, and they're safe. These are just lifetime procedures without any downtime.
Without any downtime, exactly. I mean, yes, initially people were scared how you know, they're gonna get back to an event or a holiday if they have fillers, but now there's hardly any downtime.
Absolutely, there is no downtime at all.
Yeah. Okay. Now that we're discussing about these fillers specifically, I'll come to Neelam, and this one interesting question that I want to ask you. Neelam, you've been a part of this one industry which has always been very demanding in terms of beauty, and you know, we've heard about it, we've discussed about it a number of times. What's your opinion on skin treatments and fillers, to be specific?
Earlier, you spoke about apprehensions. So I had so many apprehensions when I got it done. And the first time I got it done was with Dr. Monica. I mean, she can tell you I was so paranoid. I was so scared. I used to ask her so many questions. And also she has sort of educated me that, you know, the different types of fillers for different parts of the face. Now, I just feel that a doctor has to, you know, inform the patient and educate the patient so that they feel more comfortable. And honestly, you know, you're talking about the film industry. I mean, frankly speaking, I mean, even if I wasn't facing the camera, would I do it? Of course I would do it. I mean, there's nothing wrong with it. And I don't know why in our country there's this stigma. It's a taboo topic. You know, no women, I mean, no woman goes out there and says that, okay, I did a filler. I mean, to me, honestly, you're just aging thing. Okay? You're reversing the clock a little bit. It's not a miracle drug, but yes, it's definitely turning back the clock a little bit. And I just feel, especially at my age, why not? You know, if it's not that I'm plumping myself up and I'm looking weird, or, you know, that's when I say, okay, you know, the person is doing too much. And I think people also have apprehensions because I think about 10, 15 years ago, you have seen, procedures going wrong. So I think that's why people have so many apprehensions. And I think medicine today and science today has advanced so much that, people need to know that, okay, yes, God forbid, if something does go wrong, if your filler does go wrong, it is reversible and it can be repaired.
Yes.
So I think people need to know this and they need to be a little more educated about it.
Yes, right. I agree. So, like Neelam just mentioned about, being aware and making an informed decision. Mr. Sathya, I would come to you and I would want to ask you, how do you see Galderma shaping the aesthetic market?
Okay. So again, before I answer that, Sukriti, again, I'd like to add to what Neelam said. Earlier days, now there are a lot of advancement in terms of science, and we have so many new products available. For example, we have a product called Restylane Lift, that is for lifting. Restylane Volume, that's for filling. Restylane Define, that's for more softening and contouring. And also Restylane Kiss, that's for the lips. And also, we have another amazing product called Restylane Skin Booster, that is for hydration and glow. And also coming to our vision, and then what is that we are going to do? India still, the market is very small and also it's evolving, right? That's going to be the future. Right. So what, as a global leader in dermatology, what is that we want to do? We want to work on multiple levels, right? So one is, again, we want to work on customer education, individual doctor education level. And second is we want to work with the plastic surgery and also dermatology association, and then take this medical education to the next level. And also we are creating center of excellence in different cities so that we are able to bring doctors and then we can train them there. And also going back to what Dr. Monica and Neelam said, and also we want to really educate the end consumers, right? So that the fear of injectables on the face, so that they are able to drive consumers to the patient's clinic, to the doctor's clinic, so that they are able to go and get those treatments without any fear, right?
Yes.
That's what we are doing. We're planning to do as a organization who's leader in dermatology.
For the industry, right? Okay. So, so now I'll come to Dr. Monica, and again, an interesting question that I have. It's an instant world we live in. We have instant coffee, we have instant messages, everything is instant. And we, as a generation, I would vouch for it. We need instant results. We are for it. Since people are mostly looking for instant glow, very Instagram term I used. What are the treatments you advise for that? Can these fillers be used for the same?
Yes, definitely fillers can be used because they hydrate, they all are hyaluronic acid, they absorb more water, and if there's volume loss, we definitely need fillers. Either lifting, contouring, whichever, even for dry lips, you need fillers at times, they can really hydrate. But what's in right now are the skin boosters. These are called injectable moisturizers. You inject them and they give you a nice glow. People talk about XYZ facial for a glassy skin, and that's not true. Nothing can give you results like fillers or skin boosters. So something else I would say would be a gimmick, but this is a reality that you really need to inject at times. With aging as well, the HA goes down, there's loss of elasticity, there's breakdown collagen. You need something which hydrates from within. Anything superficial doesn't work. Yes. So even if you're young, you've got acne scarring, you've got fine lines, you can inject skin boosters. You have more mature skin, you have volume loss, you require a little lift, a little contouring. You can again use fillers, and not only for giving a contour or refinement or defining, it's also for the hydration. So that's it. Depending on the concerns, we can use multiple things. We can layer these things. We can use a lifting filler, the contouring, and then skin boosters on top.
Okay. I was actually going to ask you, can we combine two of those and do it at once in one session? We can do that. Okay. So another follow-up question I have on this.
Monica, how come you're not using the skin booster on me? I'm very upset.
Neelam, I like the platform you chose to ask her that question.
Skin booster now.
Now, this is the first time I'm hearing about skin boosters. Can I add to what Monica just said?
Yeah, of course.
So for women, it's when they're getting older, it's a battle. You also want to look slim and trim and lose weight. And now the problem is when you lose weight, then your skin sags.
Right.
So I just feel a filler enhances it, sort of, makes you look a little more youthful. I just wanted to add to what Monica said.
Great. No, I was actually Yeah, yes, yes,
Again,
yes.
Dr. Monica is a very good term, injectable moisturizer. Right?
Yeah.
I was really surprised. I mean, I rolled my eyes when she used that.
Yeah.
What is this?
That's our Restylane Skin Booster. Then to answer your other question, can we use all this product? Yes, why not? Again, I have tried all this product on my
Wow. Okay. So, Dr. Monica, another question. Is there a specific age you recommend or any time, any phase of life when you feel these are the safest to go for? Or as in, I mean, when we should start with it, if at all we have to?
I think anybody can do it if they're having deep set eyes. Indians, we do have deep set eyes and they're looking tired all the time. And it's even social media when people are taking pictures and they're feeling very low that, they're always looking tired and they have dark circles. It's just dark circles because of volume loss, you can actually correct them. Somebody's having very thin lips or a short chin. They can do all these things. And average age of skin aging is around 20 to 23. So we definitely require these things.
Okay. Neelam, I'll come again. I'm coming to you. And for this question, I want to ask you. So, we are talking about beauty regimes, and you can perhaps explain this much better. In times, there were times, I mean, there still could be, when women are told to look a certain way. I'm not talking about a specific industry or, but there was this expectation that you are this age, you have to look this way. You're this age, you might do this and you will look better. We are always told to look a certain way. How important you think it's for us, for women, to hold her right to make these choices about her skin, about her looks, whether or not to go for these treatments? What do you think about that?
Anybody is saying that you need to look a certain way, yes. I mean, I do realize that today's social media is such a big thing. Okay. Yes. But at the end of the day, it's your choice. It's a personal choice. As to what you feel good. Does a woman have to do all this? No. Does a woman have to look, good and fit and everything? No. It's a personal choice. How you choose to take it forward. If doing a filler or losing weight or doing whatever procedure or treatment or whatever exercise you're doing, if it makes you feel good, it's great. So I don't think there's any thumb rule to this, frankly speaking.
Right. And even seeking permission. I mean, why? If you want to do it, go for it, right? Okay.
Yeah, it's a personal choice.
Okay. So for this one interesting segment that we are now at, Dr. Monica and of course Mr. Sathya, we also have got a few questions from our Femina readers, maybe few myths that are attached to derma fillers, and we would want you to answer these for them as well. So can we start with that?
Yeah, sure.
Okay. I'll ask a question, whatever the common queries that we get, and between you two, you can decide who wants to answer that, or if both of you, why not?
Sure.
Okay. So the first one is, of course, yes. Why not? I'm sorry. My bad. I forgot. Of course, yes, Neelam. Somebody who has actually gone something for something like this, then yeah, why not? Why shouldn't we opt for permanent fillers? That's one of the most common questions that we are being asked, that if these are safe, if it's all fine and the technology has advanced, if these are they are backed by science, why can't we go for permanent fillers?
First of all, anything that's permanent in the skin or the face would lead to things like granuloma formation or a foreign body reaction. So that's one thing we should avoid. Second, with age, there are bony changes. What we do at that age might not suit after 10 years or after a decade. That would start looking unnatural or overfilled, or it might not look nice because the bony changes, skin changes, all of that is happening with age. So we need something which we are correcting for that particular age, and it's reversible.
Okay.
For us to start looking natural.
Right, right.
People who got semi-permanent fillers done even years back, they start looking unnatural because that was done for that particular age. Now with this sagging and these fillers are like this, so
Right.
the mid don't age that much as compared to the lower face. But these are like here, so they start looking very unnatural after a point.
Right. Okay.
Yeah, just to add to that, Dr. Monica said, our products are again, it's more of natural. It's more of a technology called NASHA, non-animal hyaluronic acid, right? Which gives a natural entanglement, right? Instead of going for a permanent filler, it's more of a natural.
Okay. Okay. Neelam, there's this one question that whenever we have a celebrity on our panel for any discussion, we always our readers always send us this one question, which I'm very afraid to ask people, but because you've always been honest and transparent about, there's no filter, I think I can go ahead and take that leap of faith and ask you this question. There's this, there's this, people have this, idea in their head about all the actors in the industry definitely go for these fillers. Is that true? Does that happen?
Anyone else? Frankly speaking, do I know for a fact that they do it? No. Does everyone do it? Maybe, maybe not. I honestly have no idea. I wish I knew.
Okay, I'll twist it. Is it?
No, I keep on asking Monica. I said, okay, tell me who else comes to you.
That's a nice way to put it.
Nobody discusses it. And I'm like, come on, Monica, just tell me who came today. So her lips are sealed. So I have no idea who's doing it, who's not doing it, frankly speaking.
But okay, I'll twist the question. Is it important for everyone to go for, is it needed, something like mandatory?
It's something, if it's required, then possibly someone will do it. To answer your question, is it really a necessity? No, it's not. But it's if a person wants to raise their cheekbones a little bit, have a little bit of a lift, of course. And if you are facing the camera and you do want, a little bit of enhancement, then maybe they are doing it. But do I know for a fact? No.
Okay, I'll leave it there. Not gonna drag you into difficult spots.
I don't know.
Dr. Monica, I'll come to you now because I think you can better explain this question. So there's this one common myth, I'm assuming it is, and I would want to know from you, that these fillers stretch and later sag the skin around the area where they are placed. Is that true?
No, that's not true. In fact, when the right product used at the right depth, will always improve the skin quality, texture, and prevent further aging. Because it also leads to collagen production. So these all are anti-aging, provided we use the right product, right depth.
Right.
It requires a lot of expertise, to inject. You just cannot overfill it. If you overfill it, that would be a problem.
Yes. I actually would now ask Mr. Sathya about this question because you are in this company who's responsible of creating such a product and in derma fillers, and the kind of R&D that goes into it, then later training, education, awareness, everything involved. There's a certain price to it, but people still complain about these treatments being expensive and all of that. What do you have to say about it? That these are always expensive.
Yeah. So like you said again, all the products are backed by so much of science, and then so much of innovation and R&D happens, right? And if you ask me again, like I mentioned earlier, still the affordable population is only close to 200,000. Not everybody is going to get done. So the average treatment of the product costs around 12 to 15,000 rupees.
Okay. So obviously, because of what it is backed by, it comes with a price.
Completely, yeah. So much of science behind, so much of data behind. Right? So every product we have done so much of clinical studies. to assess the safety and also the efficacy of the product. So then after that only it gets released into the market. There is so much of science behind.
Okay. Neelam, I'll come to you next, and this probably you've been asked this question a number of times, but again, for me and for my audience who tuned in today, I want to ask, what is your beauty regime like? What do you do? I mean, that glow is blinding my eyes through the camera lens. So I would want to know what it is. Apart, I mean, don't look at Dr. Monica.
You're very kind. You're very kind, I must say. I mean, honestly, like I said earlier, it's a combination of everything. You have your nutrition has to be good. You have to work out. Your lifestyle, I think also what you are within shows on your face also.
Right.
Yes, a healthy lifestyle obviously goes without saying. And you need to maintain your skin. Okay. It's not like you just go to your dermat, visit them, maybe once in 6 months. But there has to be a follow-up. There has to be some sort of regime, a routine that you follow. It could be moisturizers. It could be, retinol or whatever it is. I mean, you need to maintain your skin. And, like they say, you've got to be squeaky clean inside out. Yeah. So you know what? It's just it's a holistic thing. Everything goes hand in glove.
Hand in, yes, right. Agree. Okay. Last question that I have: do these fillers work as the replacement for a facelift? Dr. Monica, would you want to answer that?
Yeah, see, what happens is when you talk about facelift surgeries, there's excess skin which has to be excised. Now, if you start doing this treatment when you're younger and you're actually creating a lift, so that kind of surgeries won't work well. There you need dermal fillers. But obviously, even if you do a surgery, you still require a lot of filler.
Yeah.
So it always works well.
All right. Okay.
Person requires how they have aged, how much is the skin laxity. It depends on a number of factors. Right.
And would you also want to comment on a specific routine that needs to be followed once these fillers are done?
See, even before they come in for a filler, there's certain checklists that needs to be done. So no peels nasal at least a week prior in case they're using glycolic acid retinol products. Any retinol 3 days prior, any history of cold sore, they have to take any antiviral if needed. And post they have to avoid antioxidants, omega-3s, anything that can cause bruising, avoid alcohol, strenuous exercises, too much of heat, steam, sauna. All those post-care has to be done, not to put pressure or massage your face immediately. And the treatment that needs to be taken, any energy-based device has to be 2 to 3 weeks post the procedure.
Okay, all right. And because you deal with people on, you deal with them day to day, and you are educating them about fillers and about these treatments. Is there any other myth that they come with that you want to address?
I'm saying that they say it's expensive, but I explain them this way, that in case of taking a hydrating facial, which is costing about 3,000, 4,000 a month, and they can go for a skin booster which is about 15,000, but they have to understand it's paying upfront for like 6 months. The longevity of that product is for 6 months, and if they divide the cost over 6 months, would be 2,500 a month.
Yes, right.
When you split that cost, then they understand it's not expensive and they're ready to go for it. And especially filler, if I say would last for about 1.5 years, and the cost is this much, if you divide it, then they're okay. They don't feel it's expensive anymore.
Right. Yeah, there's a way to tell them and persuade them that it's okay. So
we can avoid this, but this is more important.
Right. Yes, of course. Yes. Okay. Now that we've reached the end of the discussion, Mr. Sathya, is there anything that you want to add now that we are ending the discussion? Anything from your end?
Yeah, once again, I would like to emphasize, if this market has to really grow, if this is going to be the future, like Dr. Monica said, it's going to be education, education, education. Either at the HCP level, doctor level, or the consumer level, you continue to do that. I'm sure this market is going to be a huge market in India.
All right, great. Thank you so much to all three of you, to Mr. Sathya, Dr. Monica, and Neelam, of course. Thank you for this discussion. I think it was much needed, and people need to know from the horse's mouth that what's happening in the industry about how safer these treatments are, and about innovation and technology. So thanks for addressing all those queries and our audience doubts today. Thank you so much. It was lovely speaking to you.
Thank you, Sukriti. And then it was a privilege sharing the screen with Dr. Monica and also Neelam. Thank you so much for the time.
Thank you.
Thank you for having me.